Welcome and thank you for joining us. We're here at Glaucoma 360's New Horizons Forum in San Francisco, exploring groundbreaking advancements in glaucoma care. I'm Cary Powers.
And I have two distinguished guests with me here today. I have Dr. Wirostko and Dr. Jason Bacharach. Dr. Wirostko is an adjunct professor
In the Department of Ophthalmology at Moran Eye Center at the University of Utah. She is also co-founder and chief medical officer of Cularis Bio and co-founder of MyEyes, a company that specializes in at-home IOP monitoring for patients. Welcome, Dr. Wirostko.
Thank you. Thank you, Cary.
Also with us today is Dr. Jason Bacharach, founding partner and medical and research director of North Bay Eye Associates. He also serves as co-director of glaucoma for California Pacific Medical Center here in San Francisco. Dr. Bacharach is the chief medical officer for Radius XR, a company on the leading edge of innovation in remote diagnostics and eye care.
A warm welcome to you, Dr. Bacharach.
Thank you.
And thank you so much both for taking time out of New Horizons Forum to visit with us today. So you just led a panel discussion here at Glaucoma 360 focused on moving glaucoma care out of the office and to the home. So I just want to continue that discussion for the benefit of viewers at home who may not be here at the conference today. So I think a great place to start is, what are the specific areas of glaucoma care where you're seeing the most innovation in terms of remote diagnostics and monitoring? So Dr. Wirostko, let's start with you.
I guess, with the access to IOP home monitoring, we're starting to rethink and really challenging ourselves with, is one IOP measurement every few months enough? And there was a lot of discussion today from even some of our keynote speakers around, 24/7 IOP monitoring, whatever that looks like. You've got different companies coming up with different invasive surgical ways to monitor IOP. And then you also have, technologies that can be placed on the cornea or even the handheld now that patients can use at home. So that for me has been really exciting because it's changing and leading the field.
So I think a natural question that arises when we talk about these at-home diagnostics is accuracy. So Dr. Bacharach, what has been your experience in terms of accuracy for these new emerging technologies?
Well, first of all, welcome to the Bay Area, both of you.
Thank you.
It's a great meeting. Really, it's just a great meeting with a lot of, as Barb just mentioned, with a lot of innovative technology. Point well taken. I mean, these devices are innovative and novel and juicy for physicians, right? Anything that we can move out of the office, busy, impacted clinicians, into the home, get a package of information and make clinical decisions. Who wouldn't want that? But it's always buyer beware with these technologies. You have to have valid testing. There has to be correlation with gold standards. And I think that it's important to lead with the science and not lead with the remunerative or financial component with your technology. So, for example, in visual field testing, background luminance, the ability to make sure people are focused on the test, validated software programs, all of these make up a very important integral component of making sure the technology is right for you and your practice and your patients.
That makes a lot of sense. Dr. Wirostko, I'm really curious to hear from you. How are patients reacting to the ability to take part in such an active way in their glaucoma care?
And I think you hit the nail on the head. It's take part. It's now become a part of the solution. They really feel empowered. They like the idea of being able to see how exercise, diet, sleep, travel is affecting their visual function. Again, in particular, their IOP, but even it could be eventually their visual fields as well. We know there's a lot of variability from test, retest in the office, and we're gonna learn a lot when we get it into patients' hands at home. And I think what Jason brought up too, it's not right for everyone, but I keep going back to diabetes. Patients want to know their glucose. They want to use continuous glucose monitors. It improves outcomes. It saves them, their kidneys and their eyes and their brain. And I think the same thing with more, I'm not going to say aggressive, but more and earlier monitoring and intervention in glaucoma.
Dr. Bacharach, to me, one of the most exciting aspects of talking about this remote monitoring is not a patient not having to be inside a practice to get access to specialty care. So what do you see as the most important ways that this is adding access to care.
Yeah, that's great. I mean, if you think about it, the people that have the disease the worst, or the people that are undiagnosed, and we're talking about half the population that have glaucoma, are underserved communities. Impacted offices try to get a visual field scheduled at somebody's office. Take into account that these are seniors, ergonomic issues, concerns still over COVID. All of these issues have created a logjam trying to get testing done. So the ability to expand the platform out of the eco-centric office-based management, it's there, and we just have to capitalize on that with a high-quality testing system. And I think that it's going to make our ability to help patients all that much better. Barb's got a great innovative platform for at-home intraocular pressure monitoring. She shared some cases with me that blew my mind when I look at them and think about that clinical applicability in my practice.
And just diagnosing patients instead of sitting there waiting to intervene once there's damage. If you see, we always treat off of what's your highest number, what's that high pressure. And if you can identify it before you have the damage, because it may be occurring outside of the office, you can now intervene earlier. And then I think something that Jason said too, when I think about, is access to care. And there's a few patients that I know of that actually were told to think about, home monitoring and devices because they were traveling 3 hours each way to get to the office. So then you think about sustainability, greenhouse gases, loss of, hours at work could affect, your income. There's a lot of value here.
And I even think about caregivers too,
Caregivers.
for patients who can't get in on their own. So now you're impacting so many people by having to go back and forth to the office. So that's really
Nursing homes,
exactly.
even prisons, people that can't get to you basically.
So Dr. Wirostko, our learning has really evolved over recent years in terms of these fluctuations in IOP and what we know about that. So tell us more about how you think that's impacting the standard of care.
Again, I keep going back to blood pressure, hypertension, and diabetes. It's all about, even when glucose monitoring and hemoglobin A1Cs were first being validated, it wasn't until years went by that they really said, wow, if we control that glucose level sooner, we can change outcomes. And I think the same thing. We're evolving. This is, as I say, my patients ask me questions, and I'm just like, you guys are teaching me. I don't have the answers. I'm learning with them as we go down this journey.
So my final question I want to delve into today, I really want to talk about industry collaborations. Both of you have been really involved with new technologies, being on the forefront of introducing this advanced care to patients. So I want to hear about what are some of your most notable projects that you've worked on over the years in terms of industry collaborations.
Jason should start on that.
Well, the only good thing about being the OG, the old guy, is that you have, a pretty long shelf life of thinking back and thinking about the innovations, the ones that worked. And sometimes you learn more from the ones that didn't work than the ones that did. But, in my particular career, I've worked both on the diagnostics as well as the therapeutic side through industry collaborations at our research center here in Sonoma County. And it goes all the way from validation studies for some of the machines that we use, like OCT, in terms of diagnostics. And then on the therapeutic side, having the opportunity to be one of the early MIGS investigators and implanters in the United States, all the way up till now with drug delivery and being involved with some of the new drug delivery platforms. So it's just been a great ride. It's really wonderful. Today's meeting's a perfect example of that great synergy between the clinician, the clinician scientist, our industry partners. We couldn't do it without that collaboration, and I'm sure Barb agrees.
Yeah, and even, especially the nonprofits and the patients, right? But I think it's really cool because you're asking questions and you're trying to solve problems along the way, and you're absolutely right. You may not always know the answer, and there's plenty of drugs that have, died on the vine, and because they didn't have the good efficacy or the safety profile that we needed. But we're always thinking. We're always out there trying to figure out what can we do to save vision.
Well, thank you both so much for spending time with us today and delving more into moving glaucoma care from the office to the patient's home. So I want to give a huge thank you to the Glaucoma Research Foundation, the incredible work they're doing at Glaucoma Research Worldwide, and also to the Glaucoma 360 New Horizons Forum leadership. Thank you for bringing us all together for this platform to learn about these exciting new technologies. So thank you to Dr. Adrian Graves and Dr. Andrew Ewok. Thanks for joining us.
Thank you.
Thank you.